All right. Good morning. It's 9:05, so we're going to go ahead and get started. I'm Catherine Villarreal. I'm the Vice President of Public Affairs at Coalition for the Homeless of Houston and Harris County, or as we like to call ourselves, CFTH. Thank you all for joining us today, both in person and online, for our inaugural State of Homelessness in Houston data report, including the announcement of the 2026 head count results. I want to make sure, first of all, everyone watching online can hear us. So if you can hear me, can you give us a thumbs up using your little Zoom reaction button? All right, I'm seeing some thumbs up, so we're good to go. First things first, if you participated in the PID count this year in any way, please raise your hand or give us a thumbs up. All right, please give yourselves a round of applause. It would not be possible without all of you. Now, if you're affiliated with The Way Home, our homeless response system, let's get another hands up or thumbs up there online. All right, please give yourselves another round of applause. All the progress that we have made is shared, and it is thanks to all of you because no one agency working alone can solve homelessness. I also want to acknowledge the elected officials' offices that are here with us this morning. We have City of Houston Councilmember at-large 5, Sally Alcorn's office here with us. We have Harris County Precinct 1, Commissioner Rodney Ellis's office here with us. Harris County Precinct 4, Commissioner Leslie Briones' office here with us. And I'm sure there are others online. Is there anyone in the room that I missed? Okay, great. We are glad to have you here. A few more thank yous before we get into the program. We want to thank SimTech for being our event sponsor for the food that I promise will get here eventually. I want to thank the Council on Recovery for hosting us in their lovely space. And I also want to thank our communications manager, Sarah Hart, who organized today's event. All right. Thank you, SimTech. Here is our speaker lineup for today. So we'll hear from my colleague, Renee Cavazos, who is the Vice President of the Homeless Response System. We'll hear from Dr. Ben King from the University of Houston Fertitta Family College of Medicine, who's our epidemiologist who did the independent review for our PID count. We'll hear from Jabel Johnson from the City of Houston Housing and Community Development Department. We will hear from Tao Costas from the Harris County Housing and Community Development Department. And finally, we will hear from Kelly Young, our President and CEO of CFTH. And after that, we will take some live Q&A, both from our in-person attendees, that's what those little cards are for, and we'll take some Q&A from online as time allows. So hopefully, if you are here with us today, you know who CFTH is, but a quick refresher. We're a nonprofit organization that leads and coordinates the region's response to homelessness. We bring partners together to work as one system. We use data to guide decisions and improve outcomes. That's part of the reason that we're here today, to present you all some data. We align funding, strategy, and services, and we help move people into housing with the support of the partners of The Way Home. And speaking of The Way Home, in case you haven't heard about that, The Way Home is the homeless response system and continuum of care, as the U.S. Department of Housing and Urban Development would call us, for the City of Houston and Harris, Fort Bend, and Montgomery counties. So really important to remember, it's not just Houston, it is all 3 counties, Harris, Fort Bend, and Montgomery counties. Can we get some thumbs up there if we've got Fort Bend County and Montgomery County folks on the Zoom? Well, I'm sure they're there. I know it's hard to drive, so thanks for watching. It's a public-private partnership of dozens of organizations aligned around a shared mission of making homelessness rare, brief, and non-recurring. And we do that through coordinated housing and stability services. And I think we actually have maybe even a bigger number than that. I think we've housed closer to 40,000 people since 2012, which is amazing. And now I'm pleased to introduce my brilliant colleague, Renee Cavazos, Vice President of the Homeless Response System, to present some of our data results.
All right, thank you, Catherine. For those that I have not met, my name is Renee Cavazos, and I serve as the Vice President of the Homeless Response System. I have the privilege of working across the way home year-round with providers, HMIS, coordinated entry, planning, performance, governance, to understand not only who is experiencing homelessness on one night, but what is happening across our system every day. And that is where I want to start. And the point in time count is important. It gives us a federally recognized snapshot of homelessness in our region. It helps us understand trends. It helps us tell part of the story locally, statewide, and nationally, but it is still one night and one moment. And no one single number can tell the full story of homelessness in a region as large and diverse as ours. So when we look at the point in time count today, I want us to look at as a doorway to a larger conversation. Not just what is the number, but what does the number tell us about our system? What does it tell us about our housing market? What does it tell us about our capacity? What does it tell us about exits? And most importantly, what does it ask of us to do next? This year's story is steady but pressured. Steady does not mean solved. It means the system is holding the line while new people continue to fall into homelessness. And if we want the number to move down in a meaningful way, we have to do both. Create more stability pathways and prevent more people from entering homelessness in the first place. Because the reality is homelessness is not created by one system. It is created by multiple issues and systems along. And whether communities have built enough infrastructure to respond before crisis becomes homelessness. That is why we cannot understand homelessness with one data point alone. The PIT count gives us the snapshot. The State of Homelessness report gives us the system picture. And the system picture tells us that the way home is working every day, but it is working under pressure. Across the way home, we serve nearly 36,000 people. We helped more than 21 people transition into housing. More than 7,100 people entered homelessness, and 85% who exited the system remained stable. Those numbers tell us something important. They tell us providers are moving folks from homelessness to stability. They tell us that when people are connected to the right intervention, stability is possible. But we also have to remember what is not fully captured in these numbers. This does not include the full scope of the domestic violence system, who is serving survivors, around 20,000 people more a year. It does not capture every child, youth, and family identified through school systems in the McKinney-Vento. That is an important reminder that the need in our community is broader than one report, one database, and one funding source, or one public-facing number. And together, all of these numbers and all of these groups, housing providers, healthcare providers, faith-based organizations, advocacy community groups, help tell us a fuller picture. So yes, these numbers show progress, but they also show pressure. They show that the inflow is still very real. And they show us that if we want homelessness to be rare, brief, and non-reoccurring, we have to build a response that is bigger than any one count annually in any one federal funding cycle. I want to be very clear, federal resources have been very, very critical to this community. HUD funding has built the backbone to the way home. And we are so very grateful for that investment. But that investment comes with responsibility. And in this moment, that responsibility also means that we have to be willing to evolve, to look honestly at what it is working, to strengthen what is helping people stabilize, and to adjust what is not producing outcomes that are needed, and to make sure the resources we receive are connected to real movement, people getting indoors, people getting connected to services, and people increasing stability and people not returning to homelessness. But it also means with great power comes great responsibility. You have to use those dollars well to measure outcomes, to meet requirements, to be transparent, and to keep strengthening the system those dollars help support. Federal funding is essential, but it was never designed to be the whole answer. If homelessness is experienced locally, then the solutions have to be owned locally. And that is the good news. Local partners show up for us. Local government shows up. philanthropy is showing up, providers are showing up, faith-based partners show up, business partners, advocates, and community organizations. And especially those community organizations, I want to just stop and name who work every day, often without a spotlight or a pat on their back, who open doors, who serve meals, who build trust, who respond before there is a press release, a dashboard, or a funding opportunity. That work does not always show up neatly in a report, but it is part of our continuum and it is part of the safety net. It is part of how this great region cares for the people. And if we are serious about reducing homelessness, we have to see that all as part of the solution to end homelessness. So the next part is not to start over. The next part is to align more deeply around a true continuum of care, a continuum where we leverage each other's resources, where we are clear on shared outcomes and shared outputs, where the data is transparent enough to show what is working, what is not, and what investment is needed, where local investments are connected to a regional system, so where we are creating impact, not just activity. It means we use federal funding as the foundation and not the ceiling. It means we build a local response that is sustainable, flexible, pragmatic, transparent, and honest about what people need. A response that supports multiple pathways, because stability is not just a unit, it's a connection around that unit. Recently, one of my team members joined an outreach ride-along and met someone who had been housed through the system, but he was still spending time in encampments because he was struggling to access food and the supports around him. That is not a failure of that team that housed him or the person or program. It is a reminder that the full system has to be easier to navigate, accountable, and more connected to the people. That is a systems lens, and that is local opportunity, not panic, not a single headline number, but a clear understanding of where the system is strong, where it is strained, and what we are willing to build together. And we cannot lose sight about the people behind all of these numbers today. These individuals were veterans, neighbors, mothers, fathers, someone in a family, who belongs to a community, and somebody that's bigger than one number can ever report in a formal report. So our responsibility is not just to simply count homelessness. Our responsibility is try to understand it, to respond to it, and to fund what works, to be honest about what it is missing, and to build a system where people do not have to wait for a crisis to become visible before help becomes possible. That is why we are looking closely at the future of our PIT count methodology. With our partners at the University of Houston and STEMtech Solutions, we are asking how we can keep improving year after year, how we can better capture what is happening, how we can learn from innovative approaches in other communities, and how we continue to move toward a system where a PIT is just not a 3-night search, but closer to a roll call, where our full system has the coordination, capacity, and relationships needed to know who in the community is living unsheltered, understand what they need, and connect them to the right next step. That is the goal. And it's not because the PIT count is not important. It's because the strongest homeless response system is one where people are not invisible the other 364 days of the year. And we saw a glimpse of that this year. After the count, the VA requested geographic information so they could follow up and engage with veterans identified during the count. That is exactly what the PIT count should do. Not just report, respond, not just count, connect, not just measure homelessness, but move people toward help. And that is the challenge in front of us. So again, the PIT count gives us a snapshot, our system gives us the motion, and our partners give us the context. And our local investment will determine whether we can move from managing homelessness to truly reducing it. And that is where we are headed next. In 2027, our region will launch the next community plan for the way home. The plan will help set action, goals, and shared priorities for the next 3 years. It cannot be a plan that sits on a shelf. It has to be a plan that helps us answer the question the PIT count puts in front of us today. What are we willing to build because what we know today? And that is where the next chapter of the way home will go. A system that is federally supported, of course, but locally owned, locally strengthened, and locally sustained. because the goal is not just to have better numbers next year. The goal is to have fewer people experiencing homelessness because we built a community response strong enough for that moment. My hope is as we look at the data today, we do not see it as just a count, but as a call to keep building, not for the people and the full system around it. With that, I will turn it over to Dr. King, who will take us deeper into this year's PIT count results.
Let's see. Okay. Hi, everyone. Thank you for being here this morning. And now I'm acutely aware of the fact that the food has arrived, and I'm standing between that and the break that we all anticipate. But I do want to take a moment to talk about the details of this, as well as start by thanking. First of all, can you hear me in the back? Sound okay? Okay, good. First of all, by thanking our partners at the Coalition for the Homeless, who really have been so collaborative. We worked on a really tight timeline for the report this year for a number of reasons. Delays both on the front end and then, of course, pressure for reporting that the federal government requires on this side. So really fantastic work, especially to the team that worked on communications right at the end, the quickest turnaround we've done on this. And I want to thank my team as well, the team that helped review and consider all of the adjustments as we calculate and find the details on what to report within this point in time count. So we've already spent quite a bit of time contextualizing this number. And I think it's really important that we think of this as a snapshot, right? This is point prevalence as opposed to system throughput or outcomes. As we think about this, I really want to think of this as, a static single perspective that we have. But one of the hallmarks of it is the stability. So the other thing that we wanted to characterize here is just as we look at the overall count, the methodology for collection has been really consistent over a good number of years. We have made some changes within the internal considerations, some of the subpopulations, and I'm going to talk about that in a moment. But as you can see, really a pretty steady number over time, which I want to contrast with the turbulence. And many of you have read national stories of the changes in the overall PIT. Recently, they released the 2025 annual homelessness assessment report, which showed even fluctuation once again. So after a couple of years of the largest increases nationally in homelessness that we've ever seen since we started measuring it, we now see a slight decrease, right? They're starting to improve post-COVID, and some of those adjustments, right, at the national level that had to do with fluctuations and transfers and to an extent the migration issues that we saw over prior years. All of that really has not borne out in our local community, which is something in itself is a remarkable finding. The stability of this number as we continue to see sort of a flat trend after, we wanted to color in the 2021 count was really unique all across the country. That's a anomaly. But since then, really a flat line while we saw jumps in other places. So, as I said, we were really consistent in the way that we collected the unsheltered count, leading to some of this stabilization. But we did apply some improvements to that system this year. And so for those of you that I know are really thorough in reviewing these reports year after year, and we get great questions both at this release, but also over the coming months, any questions are probably going to get tied back to the fact that we implemented some really innovative approach that I think improves the rigor of the data quality internal to some of the subpopulations. And I know this is where we get into the weeds, and sometimes I lose people. I promised I would only use the phrase multiple imputation with chained equations once. Um, but the process for how we extrapolate, particularly into missingness, which is inherent to the kind of massively complex and very tricky process that the point in time, especially the unsheltered count, involves, there's really only the best way that we can is by using the information we have, and the term is to impute information into that missingness. I'm happy to talk about it if anybody else is interested, but I'll move on from there. Now, there are several steps before we get to that layer of imputation, and in particular, right, looking at the reports, carefully considering and partnering with our colleagues, particularly with the HMIS system, that's the Homeless Management Information System, and the data that's collected through our partners in the GIS-based application that the collectors use. We're able to look at all of those records and deduplicate, right? Pull down the records and really identify, make sure that we're counting one person once. That's the whole point of a point in time count. So that process really is very thorough, adjudicated with multiple eyes. And then, before we start looking and treating each case as a unique case that we can impute information into. So enough about the methods, right? There's just a couple of things that I want to highlight. Every year, my goal is to highlight something that I think is really interesting about this population that we can capture and uniquely characterize through the PIT, right? Like we said, it is one perspective. And you'll hear several people say that it's one piece of how we view and understand homelessness within our community. But it is unique in that it also gives a snapshot of things that we don't usually get to measure. And so I find that it's a really good opportunity for us to characterize some things that we don't look at. Last year, for example, we spent quite a bit of time looking at, for example, the overrepresentation of African Americans in homelessness and how we can really best understand that, particularly in the process has continued, right? So I'm not going to highlight that finding this year because I want to find new, unique things to point out to everybody. But as we continue to identify these things, we're also finding ways to address and programmatically kind of try to resolve those issues. Renee was kind enough to mention that the coalition is going through a community planning process right now, and these kinds of elements and to address through that as well. One of the things I thought was really interesting is is that families are locating in shelters. That's good news. I wanted to start with something. It is incredibly rare to identify families in the unsheltered setting. 97% of folks are in the unsheltered setting are over 25, and the rest are 18 to 24. There was very few, like a very small number of families identified, as opposed to the vast majority count. That's where they're located. They're finding services and they're finding safe spaces for them to shelter, and that's a good thing that I wanted to highlight. Really, just a dramatic difference in that proportion. Less good news. One of the biggest disparities I think we have and we're able to identify in this report is the difference between those who report a disability of some kind, which is preventing them from work or maintaining shelter or housing, and the number of people who are on specifically designed for that exact characterization. Right? So we have a huge gap in the community between the people who are receiving benefits that they, at least by their own self-report, should be eligible for, right? As opposed to where we are with the burden of disability in this population. So what you see here is just a clear difference in what we're able to address. Now, of course, this is not a failure necessarily of any one system or any one program. In fact, disability benefits themselves are famously very, very, I can say it 10 more times, very hard to apply for. Notably, and I won't, it's a different soapbox. But we have to find a way to bring these numbers closer together. We have to bring down and find ways to address the amount of disability in the unsheltered population. This is an unsheltered number, by the way, not sheltered. This is uh, something that we need to bring that number. We also have to find ways, through intervention to try to bring that benefits number up as well. I think that's going to be really key because that's how we create stabilization. Let's see. That's not me. That's back to the title slide. So without further ado, am I tossing to... I read this earlier. Without further ado, Jamel Johnson from the city of Houston.
Good morning, everyone. I am Jamel Johnson with the City of Houston Housing and Community Development Department. Director Nichols extends his regrets, but I am proud to serve in his absence this morning. Thank you to the Coalition for the Homeless, the Way Home Partners, the volunteers who participated in this year's count, and those who worked tirelessly each day to address homelessness across our community. As we look at this year's data, one message resonates: a story of stability. In a time when communities across the country continue to face significant housing and economic pressures, Houston's homeless response system has remained relatively stable. That's important. The data reflects a system that continues to connect people to housing, supports long-term stability, and coordination of services across the region. It also underscores the need for continued partnership, investment, and action to address homelessness. Moreover, these results reinforce that progress does not happen because of any single program or project or organization. No single intervention solves homelessness. Let me asterisk that. No single intervention solves homelessness. What makes a difference is having multiple pathways that help people move from crisis towards stability. That is why the City of Houston continues to invest in front doors in concert with the homeless response system. One example of that is 419 emancipation. We view 419 not as a standalone solution, but as one component of a broader homeless response system. Its purpose is to help connect people to care, services, shelter, and housing opportunities that move people toward long-term stability. Now that 419 is operational, we are optimistic that this triage, transition, and treatment model will strengthen our community's stability to connect people with the right resources at the right time. The broader lesson from today's report is that maintaining stability requires continued commitment, coordination, and investment. Most importantly, behind every number discussed today is a real person, a neighbor, a family member, someone who's working to overcome challenges and build a more stable future. Our goal is simply not to measure homelessness. Our goal is to ensure more Houstonians are connected to the care, services, and opportunities to help them move towards stability and independence. Thank you, and thank you to everyone who played a part here today.
Good morning, everyone. I'm Tal Costas, and I have the pleasure of being the Executive Director of Housing and Community Development for Harris County. So yes, it's good to know that our point-in-time number has stayed stable over the last few years, which was a real concern during COVID and then after COVID. If you remember that second slide that Dr. King showed, other communities, it spiked immediately the year after COVID dollars went away, or actually after that year of COVID. So we must continue to focus and stay working together to make homelessness that rare, doesn't occur, if at all possible, brief. When it does occur, how does it go quickly? How do people get out of that situation quickly? And non-recurring. When somebody does experience homelessness, let's make sure that they don't ever have to do it again. So we have some major headwinds in front of us. And our Harris County leaders, our commissioners, our county judge, they are all committed to tackling this issue. Their vision is that by 2050, all residents in Harris County will be living in safe, thriving, resilient, connected, healthy, and secure communities. These are single words, but there's much substance and community development efforts behind them. So the term secure applies to our topic here today. And it centers on all residents having quality, affordable, and safe housing. Because our leaders know that good, stable housing is a necessary foundation for the community's well-being. Specifically, the county is committed to the full spectrum of needs, ending the homeless experience by supporting permanent housing, reducing evictions, and increasing affordable housing. Unfortunately, many of our renters, our residents, don't have stable housing. In fact, more than 76,000 eviction cases were filed against Harris County residents in 2024. And that's the last full year of data that we have right now. That's 1 in 10 renters. And we just heard from this data here that over 7,100 people entered homelessness for the first time here in our community. So this figure correlates to, and I didn't check with our statisticians, but 1 in 10 people who had eviction filings, this equates to that number. So we really digest that and think about that for a second. Perhaps it's not causation, but it's very, very close to this concern. And sadly, evictions have not slowed down. Only New York City and Phoenix record more total annual eviction filings. But as a percentage of population, we are outpacing New York City because they have almost twice the population that we do, and they have a higher percentage of renters. This does not bode well. People's income is not keeping up with the rising costs of housing. It's a problem of supply and demand. Too many people needing too few available affordable homes. And it will take everything that we have been working on over the last 15 years and more to keep making progress in this effort. And the Coalition for the Homeless, our city, county, private sector, and all of you, we're all working on that, and you'll probably hear from Kelly about how that progress will be moving forward. Meanwhile, it will take us building more housing and thereby improving affordability so that people can stay housed and thrive. And our city and county are working together on that issue right now. We are developing a regional plan, coordinating our efforts so that we can tackle this problem at the broader housing supply issue, because we truly believe that we can have a community where homelessness is rare, brief, and non-recurring. Thank you. Kelly.
Okay, before I have a really loud voice, but the people on the can't hear me. Oh, did it? Did I make it magic? Oh, I did. So I did want to just mention a couple of things. I'd like for everybody just to sit for a minute and think about what has been said. Because that, I don't know about you, but from Renee, from Dr. King, from Chow, from Javel, just hearing the level of commitment and consideration and thoughtfulness that is being taken to address homelessness in our region is astounding and amazing. It does not happen in most other regions and places that I visited. In fact, when I'm asked to go and speak at other places, most of the time they're like, what do you mean you're all talking to each other? Like, I never talked to them. They said this about us 4 years ago. And so since then, we don't ever even collaborate. So I think just recognizing for a minute, just sitting in the fact that we all showed up today with our different perspectives, but understand that we have a shared agenda to address homelessness is hugely important to talking about our success. One thing I think you noticed is that we did a different slide around the PIT count, which we started with, which was to show multiple levels of numbers that we need to take into consideration when we're addressing homelessness. I laughed. I thought we should have created a meme where we're all like, it's just one day, it's just one point, because we say it over and over again, but we say it with purpose. And that is because people like to use that number to their benefit or against the system as a whole. And I just want to label it what it is. It is a number of people who stopped and got interviewed while they're living on the street. That's kind of amazing. I'm in the worst situation in my life, and I stop and let some stranger I don't know come up and ask me a bunch of questions so that you could collect data so we could pick it apart. So I ask us all to back up and remember that each one of those numbers is a person that tried to tell their story so people would understand better what homelessness is about. And when we talk about it and we categorize it, we intellectualize it, and we do all this, what we do is we dishonor their experiences. So I just want to take a minute and reflect on that. The second thing I want to reflect on is when you listen to Tao and to Javel, it's really easy to beat up the city and county for not doing enough. Trust me, I call them on a regular basis. I have plenty to say. But these are people with intention to solve a problem. And it's not the only problem they have to solve. And they're showing up every day to say, how do we apply our resources the best way we know how to do the best work we can to solve some of the biggest problems we have in our lives? So I want to honor my friendship and the work that I do at the city and county, because it is not easy to have to make choices every single day about how dollars get spent and ensuring that those are maximized and used appropriately. I want to reach out to all of my faith-based organizations, as Renee did so lovely, and everybody who shows up and says, I just can't stand to watch somebody not have water or food or shoes or something, and I'm going to do something about it. And I understand that maybe that is an issue that we have to address as a larger system, but thank you for caring and having humanity for somebody that prior to that, 60 people walked by and didn't do anything for. So I want to thank them. I want to thank every single outreach team that goes out and tries to engage people. I want to thank our hot teams that are public safety that go out, and their whole purpose is to try to have a conversation to help somebody get somewhere else. I want us to ground this in the humanity of the work of what everybody shows up every single day to do and stay focused on that. I had a few words that kind of stuck in my head, and one is systems. I hope you also got a demonstration that every single system has a responsibility to address these issues. And so when I was up at the federal offices talking to people, I said, what I want you to be thinking about is, how does each system solve the problem, whether they're creating homelessness or they're exacerbating homelessness, and how will you fund it through your system? Because we keep trying to give one person the responsibility to do this when every single system has a responsibility. And if they take their responsibility, that removes the overall responsibility on the system as a whole. I also just think it's very interesting when you listen to all of this, how many systems have to come into play together to pull off the pit count, to be able to serve people, to be able to address people's needs. And I want us to have an appreciation, a deep, deep, solid appreciation for all those people who show up every day to do that kind of work within those systems, knowing that they're going to have 100 more people come through that door without 100 answers for them. And just really recognize the complexity of that work. I want to talk a little bit more about that complexity because I think our numbers demonstrate it. I also think the lovely, what is that word that you used? Say it again. Yeah, no, I like the whole word, like the whole sentence that you used. Yes. I'm just going to put complexity and then I'm going to put that word. Because I think one thing that happens is that we want to solve things very quickly because it's painful to watch. It's hard to sit through. We're tired of hearing the same things. But the truth of the matter is this is very, very complex work. People are human beings first, which makes them very, very complex in just working with them. And then we're complex. And then systems are complex. And then funding is complex. So maybe we all give ourselves a little bit more space to recognize how good we really are in the complexities of some things that feel unsurmountable. Collaboration absolutely could not be done without everybody showing up. And one of the things that happens is people tend to want to pit people against each other. You're not doing enough, you're not doing enough, you're not doing enough. we are all doing what we can do. If we want to do more, that's where our collaboration has been very successful. Renee made a very good point. It's not about this idea that we are at the end. We're at the beginning again. We're at the place where we get to be thoughtful and creative and innovate and do all sorts of stuff, because the truth of the matter is nothing is ever stable. Everything always changes all the time, even if things stay the same. So I'm hoping what we recognize too is that you have to, and I think the city has done an excellent job of demonstrating the need for the front door. You have to have exits, which is what the rest of the system has been doing for years. And when we have a system that goes from entry to exit, what you need in between is a bunch of different interventions that meet people where they are. Not everybody needs a place to live for the rest of their lives, because their disability still allows them to work and they want to work and they want to get out there. So what are we doing for that individual? We have some people who just hit bad times. They got cut 3 shifts at the Astros games last week, and so now they don't have enough money to pay for their boarding house rooms, which they've been staying in and are basically housed in, and now they're on the street. You have people who have terrible family situations that happen, where their medical bills ate up every single thing they had, took away their house, and now they're on the street, and everybody's like, they're all the same kind of people. We want to blame them. We want to blame the people with the least amount of resources, least amount of ability to solve their problem, when we all sit in spaces and places that can solve them for it. So I want us to really be focused in on that idea that every time we have an opportunity to provide an exit strategy to someone, however that looks, that we want to take advantage of it. And so the homeless response system took the last 18 months to really expand the idea that, yes, the way home sits here in one lane, but there are multiple lanes to this highway to get people where they need to go. And so we've been working very closely with our partners, very closely with philanthropy, to work out these ideas and strategies so that everybody gets an opportunity to get off that highway when they're ready or able to get off, not that they have to wait till the end or the dead end, where then we have to pick them up. And everybody complains that we can't do that enough. When we do all that, the steadfast of our work moves away from this number and reporting this number, and goes steadfast to talking about how we're resolving issues for people. And that becomes the system as a whole. So I really, really want to thank all of you for being here today. And I really want to thank everybody who participated in the pit. And I really want to thank every single one of those 3,000 people who stopped in the middle of the day where they normally have to go find a place to go to the bathroom, find some food, hope there's some water, hope they don't get yelled at, don't have to listen to everybody talk about how they're the danger of the community, to answer a bunch of questions so that we can figure out how to solve their problem for them better. So before we end, I want you all to give a round of applause and a thank you and a prayer and a word of kindness or a moment of quietness to those individuals for the fact that they are still on the street trying to solve these problems. And we are sitting in a nice, comfortable room. And I'm grateful for every single piece of that. But that is who this is really about. And I want us to remember that. Thank you. Those were not my talking points. So I'm sure all of my staff are like, but that is the problem when you give me a microphone. There's a
It'll work fine.
Oh, sorry.
It's talking really loud.
So if you're in person and have a question, please use one of your note cards. We'll come around and pick those up. We're also taking questions from Zoom. Please use the Q&A option. And if we could have our panelists come back up, please. right, I'll go ahead and take our first question from online. So we have the question, for several years now, since our numbers have stayed about the same, we've tossed around the idea that 3,000 is our steady state. And then
Yeah, the audio doesn't work.
You want to sit up here though so that we can get to the podium?
Okay, there we go. We're gonna do this round. So do I need this at all? Oh, okay. There's some things are magical to me. Okay. Should I take another crack at that? Is that okay? We're doing it again. Yeah. It's not going to get to be a better answer. So those in the room lucked out. The question, as I recall, was with the flat numbers, are we observing essentially a steady state of homelessness within the system? And I think that is true to an extent. We talk about this. I would say it's a theory that we've tossed around as well. So I'm not sure who asked that question, but they may have been involved with that conversation. The response, though, is that the system itself is not a steady state, is not static. And so as we look to innovate, and I referenced, well, several people have referenced the fact that we are in a new community planning phase right now. I think it's really a great opportunity to think about how we can make changes, how coming federal administrative changes and dollars, restrictions on those dollars are going to impact the system overall and make changes happen. Regardless of how well the system is performing, we are due for some shifts, for better or worse, mostly worse. And so I think how we adapt will be reflected in those numbers as well. I do not expect over the next few years to see the same flat projection. Certainly, both because we're going to innovate and try some new things as part of the new plan, but also because we expect to see the whole housing inventory shift in its profile. So that's going to be something to watch. Definitely. Anything to add to that? I mean, that's great. No, you got to come up here.
I think we're in a time where there's so many variables that we cannot predict very much about, that is going to fundamentally make everything different. Normally, when you have a shift, you have a small shift and you can game out the 6 unintended consequences of what that's going to do or how that's going to play out. And you can make some assumptions about that. I think what we've experienced, at least for the Coalition for the Homeless over the last year, has been that we have gamed out, I don't know, 150 different things. And then the next day something has changed. And so the ability for predictability is not there. And when you have no ability to predict, then you do have to look at it through fresh eyes, because the unintended consequence of not staying open when you have no way to predict is then you will miss opportunity to create what is necessary or what is needed, because you're trying to create what used to be able to be predictable. That was very philosophical for a Friday morning. But I think that's part of what it is, because part of my struggle and why we expanded some of the way we were looking at our numbers is because there are so many things that are going to be different, that even if the methodology is exactly the same, I don't feel predictable. Like, I don't feel like I can be predictive. What I know, though, is that because the system is built on the strength of the collaboration and the people who do the work and how we utilize resources, we'll figure it out. It's just very hard to answer that particular part of the question. That seem reasonable to the one person who has to figure it all out? Is that, I guess I'm gonna take that and maybe talk about a couple of things. I want to say two things. We consistently put this on the people who we've housed versus the us in the room. And so I want to think about it from that way. There are legislative fixes, there are funding fixes, there are ways to rethink systems, there are housing shortages, there's eviction issues. These are all things that sit within our ability to make changes versus making the one person, again, who's trying to figure out how to solve the problem, work those systems. So to me, it's a little bit of an opportunity to be like, right, you can't just keep hoping that one answer will be enough for everybody. You now have to be thinking of multiple issues. If we do not have enough housing, then we need to do shared housing. If everybody is expecting that, we're an extremely rich city with very poor communities. We have a poverty percentage that is astounding for how rich we are. And so it's also then backing it all the way up and saying, so PSH solved a problem for a group. It's not solving the problem for the inflow. It's not solving the problem between the 71 and 26 disconnect. It's not solving for the problem that the amount of local and state funding for homelessness is significant in terms of starting the front door, which was lovely and wonderful. But if you pull all that money back out, the city and the county do their best, but there's not a lot of resource there. And the state also has a little resource. So I guess what I would say is that we're going to have to dig deep into lots of multiple systems and lots of different ways to help people understand that permanency is not guaranteed ever. And so how do we help support you? More supportive employment programs so people could be having more income. Better systems for people who are aging out of our PSH system. We have an elderly population. I think the average age is 57 in our PSH program. That's an adult care problem in 20 years. But we know all this now. So using the information we have now to make some good estimated guesses about what to do becomes important. I think one thing is whenever you count on one funding source as your support system, you're always going to fall short. And so we've been really, really lucky to be able to do what we've been able to do and have two horrifying disasters to support that. That's not what a sustainable system should look like. I'm not sure I answered the question. I went kind of more philosophical again. I think I need a donut. Whoever asked that question, did that at least kind of hit on something? Because I can't be very specific about how all the permanent supported housing stuff is going to work out. We're just going to have to, it's a puzzle. We're going to have to figure that part out. I should have just started with that. All right. What else? Oh, yay.
Can you please speak to evictions and maybe some of the direction on the
Wow, that's a whole study trying to do that imagine the ability to keep up with the cost, sorry, of the rents that now keep going up, I'm sure, from month to month for people who are renting. They are not able to control those costs. And what are we doing? So Harris County has traditionally invested financial aid, direct financial assistance to people who are facing evictions. Now we have legal intervention, and for the last few years, and now much more pointedly, lawyers at the justice of the peace where eviction cases are being filed to provide representation to all of the people who are facing evictions. Because with evictions come very specific rules that landlords must abide by, notification, all of these things that must be followed. Can the eviction be delayed, taken off the table? How do we buy time for people to be able to make the financial means meet to stay housed and or move out of that situation that they no longer can afford? So we are supporting them in all of these different efforts. We wish we had all the money in the world to be able to address this in a much larger scale, but the county has made a major commitment of approximately $8 million over the next 2 or so years to really tackle this in a meaningful way.
The mic only works if we stand right here in the specific spot. So the next question is from online. Do we have any sense whether conducting the PIT count a month later than usual had any influence on the results?
Yes. So the reason of the PIT count shift, I think I've been over planning the PIT counts, I don't know, maybe 5 years now, maybe a little bit more. Every year, the past 5 years, there's been a pattern, specifically the last week of January, of some sort of weather event. Whether it was a freeze, a tornado, I think happened one time in the Precinct 2 area. So there was patterns. But this year in particular, HUD announced a NOFO opportunity. They announced one in December and then one later in December that ended up opening up a competition. And the bandwidth of the CFTH staff and also thinking through the partners that are applying for the NOFO is just a very big project to overtake. And we want to make sure as we roll out the PIT that there are trainings, both in person and virtual, for partners and volunteers to attend. So we try to be very intentional about things. So this year, we made the decision to shift it, and it actually worked well for us in our community. It worked well for the volunteers. It gives a good amount of opportunities for training sessions during the month of January and early February. But as for the data, I don't think that anything was affected data-wise due to the change. Yes, yes.
Super quick. When does the full PDF report come out, Catherine? Today. That was an easy one. What does inflow data tell us? Do we have thoughts on that? Do you? June 16th, Kinder State of Housing report will be coming out. That will speak to inflow. What explains the increase in sheltered homelessness?
All right. Sheltered homelessness. We had through the CUC NOFO competition in 2024, there were 2 additional projects that are awarded that were specifically a transitional housing to rapid rehousing projects. And those transitional housing projects are actually counted towards the sheltered part of the PIT count. And so that was due to 2 increases of those specific projects.
Can you expand on that piece about
Yes. So the continuum of care program can fund various interventions. Historically, our region has always focused on permanent housing interventions. So this is specific to permanent supportive housing and rapid rehousing. COC dollars can also support services only coordinated entry and HMIS and other functions. But the funding specific to emergency shelters is usually driven by private philanthropy dollars or local dollars from the city and county, ESG dollars or emergency state grant dollars as well. And so as you think of the larger picture of the capacity of the COC, you also have to keep in mind the various funding streams, the various programs. That's another thing that is a layer in our system, is that agencies have specific programs that are tailored to clients so that they can achieve their successes. And so our shelter system is broad, but is also tailored, and it is also quite successful with our shelter partners that we've had in our system.
Numbers from other sources show that Houston's homeless response or Houston's homelessness is higher than our data often shows. How do you speak to that?
I don't mean this in a way to make it sound like I don't want to answer the question, but I think it goes back to the issue of complexity. So it would depend on what is the definition, what is the area, who are they asking, what are the stipulations for that data? And that's why I think whenever any number is presented, it's why we, particularly for our PIT count, have an analysis done where supercomputered numbers, I don't know what that word was, is done so that at least for this number, we know all the layers that are attached to it, and we feel very comfortable being able to explain what the use of it is. I think whenever you're handed any number, you look at the resource and you look at the very specific data points to make sure that it's encapsulating what you're actually wanting that number for. So it's why we do a lot more in relation to our particular PIT count or any of our numbers. We can back that up with known data points, explanations, and analysis. So numbers, I think, are helpful. They also are distracting if they're being used without context or without enough data to explain what it is. So that feels like I just skirted around the question, but I'm just feeling like that's about the only way I can answer that with integrity. So yeah.
Oh, okay. So that is actually part of the way that we calculate something. Many people in this room will understand there's a very specific definition for chronicity or chronic homelessness, which includes the number of times that you've experienced homelessness as part of sort of a flow chart of questions, because that status is calculated based on either frequency or the duration of a single period of homelessness. So for the first time experiencing homelessness, it is part of a series of questions but it is a single question within that flow chart where we establish this is their first entry into homelessness that they're experiencing. That's where that is. Somebody's obviously looking at the report, which is great. I'm going to take a moment to editorialize that number is going up year over year. We know that actually from a couple of different perspectives. The pit, that number continues to rise. So new first-time homelessness is continuing to increase. We also know that from our system performance metrics, which is a longitudinal understanding of the performance of the system, also published online, but much less heralded, which shows that, again, year over year, we're actually seeing more people with a first-time entry into homelessness, which I think, to someone's previous question, will be anchored in some more bad news for the community that'll be coming out on Tuesday from the Kinder Institute. So everyone should go register for that presentation as well. Shout out to that team.
For the in and outs of those of you on Zoom, I'm sorry that we were sometimes talking to you and sometimes not. But I really appreciate all of you coming today. Again, thank you to everybody who participated in the pit. May I please give a round of applause to our lovely participants. And a last shout out to all of the CFTH team that's here that make these things happen. If you all could just put your hand up so that everybody can wave at you and think you're awesome. And I hope you all have a lovely rest of the day. Oh, and please eat now that the food is here. We don't want to take it back to the office.